Finding Calm in the Chaos. I am Denise Sith, and this is my podcast. Hello, everybody. Happy Wednesday. Welcome to another episode of Finding Calm in the Chaos. I am Denise, and oh my gosh, can I just tell you? Okay, so I'm getting over a huge upper respiratory infection. I finally can breathe a little and not feel like something's weighing on my chest. And I'm getting my regular voice back for like the 5th time. There's that. That's not even what I'm going to talk about today. What I'm going to talk about today is just what the title says. How delightful do women have just in life? The things we must go through as women. And one of those is menopause. So not only do we menstruate our entire lives, guys, I'm jumping right into it today, okay? Because there's a lot I'm going to go over, because I have been having things happen to me, and it's not medical related, like with any of my autoimmune, any of that. So I've been racking my brain trying to figure all this out. Turns out, yeah, guess what it is? It's the good old menopause. Now, mind you, I'm postmenopausal because I had my first and only child naturally at 46 years old. And the factory closed shop after that. Like, not only did it close shop, like the windows are boarded, is done, it's vacant, it's gone. Okay. It's not technically gone, like in the reality of it, but you know, in the describing it, the factory's closed. So I'm telling you guys, I'm like losing my mind. Probably because of menopause, postmenopause. Okay. So there are I have things that happen to me, and I have no idea if I'm the only person that suffers from these. And I find out I am not the only person. And I want to know, because most of my listeners are women. I want to know if you guys suffer from any of these things, or they bug you throughout the day and you have no idea that it's related to menopause, because these are some rare things that people don't talk about. Not everybody gets them. Some never get them. I seem to be getting them all. Of course I am. But like, okay, so technically, as women, right, when we reach our midlife and we approach menopause, our estrogen levels naturally decline, okay? I always knew that I was high progesterone, and so I take supplements accordingly. But I really am going to take a look at this, and I am actually going to call around for a specialist locally that specializes in hormones, obviously, to see if there are natural ways that they can assist me. I didn't do this. Like, I didn't do menopause, right? I did like weight management and, supplementation and changing lifestyle with nutrition and food for autoimmune. I didn't do nothing with this, right? So obviously estrogen levels naturally decline. As the estrogen depletion pretty much affects everything. As it declines, everything goes to hell. The hair, teeth, skin, nails, brain function. Yeah, okay. Thanks. So it's not surprising that all of these symptoms like crop up in areas all surrounding of your health, okay? It's pretty dramatic. But whatever comes up for you, this is what come up for me. There's really no need to kind of like power through it. Because me, I'm thinking, I don't want to feel this way. Wait till I tell you some of the stuff that I've been experiencing to find out it's related to menopause. I'm like, come on now. But I was at least had a sense of relief that there is a difference that could be made through lifestyle changes, wellness therapies, acupuncture, stuff like that. You can even do cognitive behavior therapy, which I'm looking into with my therapist. And of course, obviously, proper diet, proper supplementation, botanicals, or prescription medications if that's your thing. People also do HRT, which is hormone replacement therapy. That's kind of targeted to individual history and needs. Okay. I personally, that's not something that I'm interested in, but it's not for everybody. But an expert has to be prescribing it. Okay. So you have to seek out a actual clinician or hormone specialist for that, because that's personalized guidance. But getting into menopause. Okay. So when it comes to menopause, right, I have found that knowledge is power. And with that power with that knowledge, with that power comes relief from some of these symptoms. Because I was really wondering how I'm living the rest of my life with these symptoms and I'm not really feeling it. I don't want this to happen. And the more you understand about the symptoms that we're experiencing, the faster you could take a step towards feeling better. Okay. There's no reason why we have to suffer. Okay. So what do we hear? The most common symptom, pretty much the only symptom that everyone knows about, is hot flashes. But there are many, many more symptoms during hormone transitions that literally start with perimenopause, which is usually kind of like your mid-40s. But then there are some that most women don't even know about it, including doctors. Shocker, right? Because doctors don't know everything. Okay. Especially if you're seeing, I have a male doctor. I love him, but he has no idea about any of this because he is a man and he wasn't trained in hormone. So there's that, right? But there's tons of stuff that can happen to you. And I'm talking allergies, dental problems, honestly, changes in body odor. There's dozens of them. There's dozens of them, my friends. And when we're staying in the dark about, unusual, rare menopausal symptoms, I air quoted both those words, unusual and rare, air quote those, which, when they aren't so unusual at all, then they're going undiagnosed because nobody's talking about them. So I'm changing that today, my friends. We're going to talk about them because it leads to frustration and all these unnecessary feelings, days of feeling off, or worse, right? That needs to change. It needs to change for all of us because when women thrive, I'm going to tell you this right now, the world thrives with them. I'm not even joking. Now, these are 22. We're going to rip through these today, guys, because I do have an endorsement as well. 22 surprising symptoms, okay, that you're not alone if you're dealing with any of these. And I will tell you which ones I'm having because it is crazy. So there may be a lot of TMI on this as well. But if you're dealing with any of these like I am, they can all be improved or resolved with the proper support. I'm all in. I was like, thank you, Jesus, that I do not have to live the rest of my life this way because it is really ridiculous. First one, breast soreness. Just like your breasts get sore during your period. Remember those days, right? I don't. It's been a long time. Literally like a third of women experience it during menopausal transition. And this is the time that it can worsen as the hormones surge and then drop erratically. And you can even feel a burning sensation along with the general tenderness. Now, my boobs do get sore, but not as often as they used to. That has subsided. But I did have this right after, I would say, right after I met Mr. Sith. So at least 6 years before I had Peter. And don't forget, I was not supposed to have kids. So there wasn't any of that happening. Plus, I also had breast surgery. So it wasn't that as well. I had a breast reduction and lift. So I shouldn't even have been able to breastfeed, but I was able to. Okay. So yeah, common one, I guess, breast soreness, but you think it's only with menstruation, not with actual menopausal symptoms as well. Itching. Number 2 is itching, people, because it says that some women report feeling this unusual itchiness during the transition, like in your, I'm trying to read this, the North American Menopause Society. It can hit your face, your back, your chest, your genital area, pretty much anywhere, but those are like the main ones. So why does this happen? I get this all the time, and it's always in the same spots. I'm super itchy, like under my boobs, like in my armpits, and sometimes just like around my belly button. So it says estrogen helps keep skin healthy by supporting the production of collagen and natural oils, as well as retaining moisture. But through the hormone transition, right, your estrogen is steadily declining. And if it declines, that means drier, thinner, and plenty of us, itchier skin, apparently. So dryness continues post-menopause. Yay, it's not going to stop. But the itchy sensation usually will subside. Yay. But in the meantime, basically you up your skincare game. And also, if you're using the right skincare, you could reap extra, anti-aging benefits. Just saying, I'm 55. I've been using the same skincare line. You got to switch it up. For 3 years now. It's a natural Italian line from Italy. So it goes by European standards because American ones suck. And I said it. And I love it. I have 0 wrinkles. 0. Number 3, menopause causes tingling. Okay, I ain't even going to play with you guys on this one because I cannot stand it. It happens all day to me. Creepy, crawly. Oh my God, there's a bug on me. And then you got Buster, the newber, bringing in ticks. And although he has medication now he brings them in just alive, ready to jump off them like it's a bad pool death dive. Or they're already dead and they're just like flaking off of him. I cannot with the ticks this year. A strange crawling sensation, numbness, or pins and needles in your extremities, hands, feet, arms, legs, and sometimes they can happen in your abdomen, which is what I get as well. It's this odd feeling, and it usually lasts a few minutes at a time, which is true. Mine do. Again, these are caused by estrogen fluctuations, right? They're impacting our central nervous systems. And that's the root cause here, because when estrogen levels stabilize, the tingling fades go away. So I have to work on that. I'm working on estrogen right now because holy smoly, I cannot be sitting down crocheting in my den and like whacking my legs and my arms every 10, 20 minutes because I think shit's crawling on me. And it's really nothing. No, it's menopause tingling. All right. One of the ones I don't have, menopause and dental health. Failing estrogen levels contribute to loss of bone density, right? Which can lead to osteoporosis. But just like any other bones, right? Your jaw can become weaker, which raises your risk of gum disease, tooth sensitivity, pain, decay, and even lose or lost teeth. Now, I am proud to say, and my dentist at my most recent cleaning, which was last month, stated that even with lifetime dosages of chemo and radiation, she thinks that I have the best set of teeth she's ever seen in someone who's gone through what I've gone in. I don't have any cavities. They are all mine. All it takes is some good brushing twice a day, folks. When I get up in the morning and when I go to bed at night, I am an avid flosser during the day. So if I have something in my teeth, I would rather floss it and rinse it out than brush again. And that seems to be working for me. Just saying, right? Number 5, joint pain. Because you know what? Several autoimmune diseases. I don't have enough joint pain. Yeah. So estrogen helps reduce inflammation. No wonder I could never catch up. It also regulates fluid levels and it protects bones, and all those benefits keep joint pain at bay. Yeah. So as these levels decline during menopausal transition, you get the achiness in your knees, shoulders, neck, elbows, like hands might crop up. More than half of the women in this life stage suffer from aches, stiffness, and swelling. And the symptoms are usually worse in the morning when joints are stiff because you've been laying. And so it's just crazy to know that sometimes I don't know why I have a knee that will just randomly act up. And I'm now convinced that this is it, that it's menopausal. Because sometimes I'm fine. Sometimes just like once every 2-3 months, I'll step on it and I really have to catch myself because it feels like it's going to buckle. And I don't even know how I even walked down where I was. It's crazy. More. Number 6, muscle pain. Because obviously muscle pain is a normal part of aging, right? Just add that to the list. Menopause just makes it work. Yeah. So 56% of menopausal women report tight, tender, and strained muscle. Okay. And here's why. So estrogen helps to balance cortisol, which is the stress hormone in your body. So when estrus, I'm struggling with this today, guys, because I'm so dry. I'm so sorry. When the estrogen levels waver, okay, and drop, cortisol rises. It can rise, right? And in spiking cortisol leads to tight, tense muscles. Okay. So yeah, muscle pain. You're not crazy. Number 7. Okay. I was so glad when I read this because I tried to describe this to people and they look at me like I'm insane. It's called burning mouth syndrome. Imagine the sensation that you take a sip of something too hot or you put a spoon of hot soup in your mouth and you're like, whoop, yeah, too much. You know how you know instantly because the roof of your mouth is like, yeah, that's going to be numb for the next 3 days. That's pretty much what burning mouth syndrome feels like. So this scalding, tingling feeling that affects gums, lips, and cheeks. I don't get this a lot, but I do get it in the winter months. So it might be a mixture of just temperature and estrogen combined, but I didn't ever have that until recently. And the doctor just is like, yeah, I can't help you with that. I'm like, all righty then. All right, here's another one. Electric shocks. Now, if you know, you know, ladies, if you know, you know. So when you're sitting there and all of a sudden you get this short, sharp jolt, like somebody snapped a rubber band against your skin, it usually happens around my boob area. And I'll be like, oh, I could feel it oh. And it's literally because the hormone affects the nervous system and the cardiovascular system. So the fluctuating levels can cause neurons to misfire. Mine are misfiring the hell out of each other around my breast area. So women who experience these electric shock sensations often feel them before a hot flash. I have tracked that, and it is true. And they can be as painful as they sound. I'm telling you, sometimes it literally makes me jump off the couch. I will jump up and everything's coming with me because I don't expect it. It's always fun when it happens when I'm driving, if you can only imagine. Number 9, bloating. Yeah, I just can't. So this unpleasant feeling of fullness or tightness in your abdomen, right, could be hormone related, especially during perimenopause. So, because your hormones are really swinging wild then. So high levels of estrogen can cause your body to retain water, right? And things aren't much better when estrogen levels are low because that decreases bioproduction and that results in constipation, gas, and bloating, which can just hang around for a few hours or, a week. It's just ridiculous. But this is a big one because 60% of women complain of bloating during menopausal transition. But it does get better. The puffy feeling is likely to diminish after menopause. So when you get into postmenopause, I haven't had this in a while. So it did happen. And I just thought it was because I was eating the wrong foods because welcome to autoimmune world. But no, it was probably most likely menopause. And these are all things that are being either missed with clinicians or just not talked about, is what I think is the better thing, is that it's just not a topic that we talk about. Number 10, menopause and digestive issues. You know what? I had several conversations with a couple friends that were big time TMI within the last month or so, because I know that everybody suffers from this now, and it has to be this, because not all of my friends have autoimmune. But digestive health patterns change during menopausal transition for some women, apparently a lot of women. And it brings this a range of problems, okay? Constipation, loose bowel movements, gas, stomach pain. For people who already have diagnoses like irritable bowel syndrome, digestive problems are going to get worse during perimenopause. Like, oh, thank you. Thank you, drive through, if you're a woman. Like, honest to gosh, you guys. Oh, we're not crazy. We do all this and everything. It's insane. Number 11. Yeah, we all know this one, right? Thinning hair or hair loss, like noticeable hair loss, right? Shedding more than apparently 125 hairs per day in certain areas, right? Or generally less active, like growth phase, are all associated with menopause. Now, I will tell you that I don't know what this has done. It could have been the plant-based change. I don't know. But I was losing a ton of hair. I wasn't balding, but it was thinning at a very alarming rate. And when I switched my shampoo from like bottles to bars that were pH balanced and, pick your thing, and natural based, my hair got better and I don't shed as much hair as I did before. But around 80% of postmenopausal women experience hair loss. Okay. And that is a huge blow, okay, to our self-image, our confidence. We got enough stuff going on right now. A lot of stuff going on right now. And you're aging, trying to age gracefully, while the whole world fights you on that. You know what I'm saying? All these like ridiculous, almost cartoon-like social media, Hollywood, media, magazine expectations on what we should look like. It's ridiculous. But with the hair stuff, okay, lowered estrogen triggers an increase in androgen, which is a male hormone, okay? And that can mean less hair on the head, right? With fuzzy, like, new hair, which is usually on your chin. Yeah, right? And it's a progressive treatment, a condition, but treatment can help it, right? A balanced diet, taking the proper supplements. Don't tell me collagen. You can get collagen through a good bone broth or something. Stop taking collagen supplements. I know you're all going to hate me on that, but just don't. None of it's good enough to be available for your body. It's just not going to help. Reducing stress, that can help as well. Find healthy coping mechanisms, okay? But you don't stop with, I drink collagen in my coffee. Stop, it's gross. Just drink a cup of coffee because you want to drink a cup of coffee. You know what I'm saying? Come on, girls. That's all we can do, right? All right, number 12, brittle nails. Oh man, my friends with lupus and this, I can't even, okay? Dryer, crack, split, chip, curl at the ends. I can't even, right? And then if you factor in autoimmune, it's ridiculous. This is because, again, lowered estrogen decreases the strengthening keratin in your nails, okay? As well as your body's ability to retain moisture, and both lead to brittleness, right? So that's why we need to hydrate. Eat a diet that consists of whole grains. You heard me, whole grains and essential fatty acids. Our diet is our world. Our food consumption is so based on fad dieting, products, processed foods, and misinformation that we literally don't even think that we can eat grains anymore. Whole ancient grains can be healing to your body. Don't be telling me that you're not going to eat like white bread, because white bread's horrible. Don't do that shit. Don't do that stuff to yourself. And if you're a smoker, this is even worse. I don't do this, but I moisturize all the time now. Moisturize. I have some natural, I found some local family-owned companies. I forget the name of it. I'm really sorry, because I went through like so many of them trying to find one. If I remember and you want to know, I'll take a picture and send it to you. But I found a local family-owned that has a farm that does cows and goat's milk in their formulas. Oh, I love them. And they're so nice, and they're not greasy. So I have a thing about greasy because I'm always doing stuff with my hands. Plus, I'm always in the kitchen. I don't mean that like in a bad way. Mr. Sith always got me in the kitchen. No, I enjoy being in the kitchen on a good day. Okay. This morning, I actually made healthy caramel like bars, caramel bars. So I made like a crust, vegan, and I used almond flour and dates, a little maple syrup to sweeten them, some dark chocolate, coconut oil. Yep, nope. Totally freaking delicious. Oh, I also used some desiccated coconut. There's that for the crust, but it was a layer bar. So it was the 3-layer bar. I have a crust, I had a filling, and then I had a dark chocolate top. It was, I cut them into like 16 little squares, so we'd have little treat bites. So you don't have to cheat. If you want something good to eat and you want something that's healthy and whole, and you want sugars that have a lower glycemic index so that you can, I probably said that wrong. Now I'm questioning myself. You want sugars that have a glycemic index that's going to help your body convert it naturally instead of stress it out like white sugar. Okay, so white sugar is horrible, horrible, horrible. And that's because it has such a horrible glycemic index. So by using things like natural maple syrup and dates, that kind of stuff, it's just a better conversion, especially if you're diabetic or you're on the metabolic scale, metabolic syndrome area, and you're pre-diabetic. You have to do that, right? So number 13, menopause and irregular heartbeats. Now, I do have a mitral valve. It's not it's not a prolapse or anything. It's just it has a little whoof in it, and it's been that way for 30 years, and it's never changed. And my EKGs are amazing, so don't send me any messages. I'm fine. But literally up to 47% of women can experience heart palpitations during menopause transition. And they can be disconcerting, guys, okay, to say the least. Because just think, your heart is loud, it's racing, it's pounding, it's fluttering, it's skipping beats. And that change in rhythm, you could feel. It can also occur along with dizziness, okay? And that could put some people at increased risk of like heart and circulatory diseases, depending on your genetic background, your lifestyle, all of that, you know? So this is like nothing to laugh at or to scoff off and dismiss, right? Why does it do this? Because, so there have been studies that show the beneficial effects of estrogen on artery walls, blood vessels, cholesterol levels. So when the estrogen declines, it changes in those areas, and that's what can trigger the palpitations. So your heart rate can increase by 8 to 16 beats per minute. Okay. And by much more for some women. Like some women are pushing to 200 beats per minute. That is like your chest is coming through the roof. And let me tell you, this can add to a lot of other issues that we'll talk later with this, okay? When you're feeling this way, it triggers things. It triggers anxiety, depression, that kind of stuff, you know? Headaches. Number 14 is headaches. That's also because a steady estrogen level is ideal for neurological function, right? Which is why some women experience headaches and migraines during their menstrual cycles when estrogen dips. This was huge for me in my younger days, okay? Similarly, though, during perimenopause, the erratic hormone levels, they can trigger headaches. But here's the good news. Like 70% of women see some improvement after menopause. I will say I did. I rarely get a headache now. And when I do, they're always almost like a spinning. I have a labyrinthitis and I don't get it often, but it's because I have a cervical compression in my C5, C6. So there's that. Number 15, and then we're going to take a little break for an endorsement and then we'll come back. But number 15, dizziness. Oh my gosh, you guys, this has been huge for me lately. And I'm sitting here like asking my doctor, what's wrong with me? Do I have heart issues? Am I really like pre-metabolic? Like looking at, my dad has diabetes. My sister has diabetes. I'm like, I got 101 problems in the world. I thought diabetes wasn't one of them. He's like, no, you don't have it. Like, I mean, they're checking. So, you know, he says no, but I want to make sure. But 25 to 35% of women between the ages of 45 and 60 report feeling dizzy or faint at least once a day. Whoo! Ladies and gentlemen, this is me. Sometimes I get up, I feel dizzy. Sometimes I am standing up cooking, I'm totally fine. I'll turn around, put something down, get something out of a drawer, and all of a sudden feel like faint and dizzy again. And I'm like, what is going on? What's causing that? Okay. Dizziness can be related to estrogen deficiency during menopause as well as bone loss. Okay. So there's a lot of stuff going on in our bodies. Okay. Another possible cause, hormonal changes that affect the cardiovascular and nervous system, which can bring on the lightheadedness, the disorientation, the vertigo. Fatigue stemming from hot flashes, night sweats. Yeah, that only makes it feel even worse. So you're even woozier if you have those going on as well. And I only get hot, well, not only, but my largest hot flashes, I don't do night sweats anymore. I used to do them very bad, but now I don't. But the worst hot flashes come after dinner. So like evening time when I'm wound down, I am hotter than a potato. I mean, I read all these and like researched them and I was just like, thank goodness I'm not alone. I thought I was insane. The biggest thing that I have found with almost all of these is, in addition to just getting yourself checked out, if you have, like myself, I have some that are concerning that I really don't want to live with. So I'd rather just adjust whatever I need or talk to a specialist that can tell me what I can do diet and exercise wise. You could look up stuff on the internet. I get that. But if you talk to an actual hormone provider, clinician, whatnot, they're going to have all the current education in place to make sure that you're getting recent, information and education. And so for me, this was never my specialty. So I want to see a specialist and figure it out. But I do know that most of these can be helped by drinking adequate amounts of water. It's super important for us as we get older, men and women. Okay. Obviously, men are not going through menopause, but it is very important that we keep hydrated. And I'll say it again, it's half your body weight in ounces of water. And people are always like, whoo, people who don't drink water are always like, whoo, that's way too much, Denise. Like, that's a lot of water. And I always say, you know what? Find yourself a really good drink that has electrolytes in it. There's Liquid IV. There's I drink Element now, which is the letters LMNT. Drink Element. I love them, and it also is providing magnesium. I said the SH. Magnesium, potassium, and sodium, which also help regulate everything else along with it. Because obviously, with more, if I don't recommend drinking half your body weight in ounces of water if you are on any prescribed drugs for heart, respiratory stuff like that, you got to talk to your pulmonologist and your cardiologist. People will not say that. I actually, I'm going to do a little side story here. I actually worked with someone. I was a temp somewhere back in the day, and I worked with a woman who was very nice. She approached me. She was the first person to approach me at this company. And she was like, oh, just, and she was just a nice lady. You want to have lunch? So I'm not like by myself. And I thought, that's really sweet. And she's a really nice person. We're still friends today. I don't talk to her as often because she lives like about two hours south of me. But, I watch online when she posts stuff like that. But it's just was super kind of her. So my last profession at that time was nursing. And so I remember sitting down and she was talking about going to her chiropractor and all this other stuff, and that she started taking supplements, and, he gave her all these things. And as she's eating lunch and I'm eating lunch, I'm taking my supplements, she's taking her supplements. She pulls out, which is anybody who does like holistic nutrition. I had not done that yet at that time. I had not gone to do my training yet, but I just wrapped up from nursing. I retired from it because it was just too much doing 12-hour nights anymore. And I was just done. I did what I could in that profession. I gave what they gave me while I went to, did my cancer treatment and all that. But then it got to a point where it's just too much. It is exhausting to do what nurses do. And 12-hour night shifts, ER, heart transplant, it's just too much. So, there are certain pills that are very identifiable and noticeable. Like, them just by looking at them. And one of them is potassium, because they're horse pills. They're hugest. They're the hugest pills in the world. And she was just talking to me about her blood pressure has been really bad lately. And she was suffering from all these things. And sorry for this tangent story, guys, but it's important to kind of like know this stuff as well. Because it could be life threatening if you're not careful on who you're taking nutritional advice from or supplementational advice. I'm not going to say MLM, but you know what I mean. Okay. Talk to a licensed professional, not someone who thinks they're a professional because they sell a product and their company gave them a course in their product. Okay. So this is what happened with this woman. She sat down, she was talking about how difficult it was because she knew I was a nurse, right? That I had been a nurse. I was retired. And she's talking about it. And I was like, wow, just you've been on the same meds forever. And all of a sudden, like, you're having fluctuations. She's like, yeah. So I went and saw my chiropractor, and I'm like, oh, yeah, some people just love their chiros. And I'm not saying they're all bad, but I'm just saying that, they got you sometimes. You know what I'm saying? So she was talking to him about all of these issues of, her just being like stressed out and all these other things. And she felt short of breath and whatever. And so he not prescribed to her, but sold her a ton of supplements. And one of them was potassium, like straight up potassium pill, which is a no-no for anyone on a heart med. This chiropractor did not speak to her cardiologist. He did not speak to her primary care person. He didn't ask her about her medication before giving her these supplements. He didn't ask her because you know what? It's out of his scope, which is why I have difficulty with chiropractors selling nutritional stuff and supplements without being a nutritionist. It's a separate certification, folks. Your doctor can't give you weight loss advice or food nutrition advice or supplemental advice because they don't get trained for that. And in some states, like in mine in Illinois, it is illegal for a doctor to provide you with that information unless they hold a certification or degree in it specifically, in addition to their medical degree. And I believe that chiropractors should be held to the same standard in that matter. But I will tell you what I did, and this is what logged us into friends. She pulled that up to take it, and I knew it was potassium, and I smacked it out of her hand. I just instantly nurse reacted. I was like, Denise, I was like, no. And then I was like, I smack it out of her hand. I go and I collect the pill because it landed on the table next to us. And I was like, this is potassium. I'm like, how long have you been taking this? And she's like, oh, the chiropractor said to start taking it a couple weeks ago. And I'm like, you mean when your heart issues have been happening with your blood pressure? I go, that's because you're taking potassium on top of blood pressure and heart meds. What? And so let me tell you, folks, overreacted, perhaps, but that's just kind of a Denise reaction. But she stopped taking that medication. She told her cardiologist about it, who was like, hey, I'm not totally crazy, who in turn called the chiropractor and said, what the heck, dude? And there you go. That story. So there you go. I don't know. I just kind of felt like I did my job as a friend. We've been friends ever since. All right, we're going to give a second for the endorsement here, and I'll be right back. Hey friends, I want to talk to you a little today about our sponsor, which is Pet Matrix. Pet Matrix is a premium canine supplement company, and I chose this company straight off the bat for Buster and Chica. Chica is a 15-year-old Shiba Inu, and Buster is a growing large breed Newfoundland, currently at 17 months. Every ingredient that Pet Matrix chooses has a targeted benefit for your dog. Their supplements deliver natural active ingredients through a revolutionary process that they call cell matrix delivery. By applying science and including bioactive peptides in their human-grade all-natural recipes, they're able to target a dog's specific needs, plus provide the benefit nature intended. Now, I use the Think for Chica and Buster. It is a cognitive and neural support supplement. I use the Protect for Buster as well, and that is an immune and gut support. And then I also use the Move for both of them, Chica being older and Buster with growing large bones, an anti-inflammatory and mobility support supplement. If you want to check out Pet Matrix, you can check them out at petmatrix.com. That's PETMATRX.com. And you can use Buster Sith at promo for 20% off. Again, that's Buster, BUSTER, Sith, SITH, no spaces, and get 20% off your order. Hello. Thank you, Endorsement Pet Matrix. I love you. A great family business. If you have not looked into Pet Matrix for your dog, supplements, premium canine toppers and supplements, absolutely amazing. They have been everybody who has taken the leap and tried them that I know, they're like, oh, I'll try them because nothing else is working. And then they're just like, these are the greatest thing. I could see the difference in my dog's coat. I can see it's made a huge difference. The products are outstanding. So give them a try, and always use Buster Sith. Like I said, he'd give you 20% off. Number 16, we're talking about how delightful it is to have menopause. In general, as a woman, all the freaking stages of it. So number 16, I'm going to try to wrap this up within an hour. Friends, I'm going to try. Allergies. My friends, I can't even tell you, okay? Do foods and environments that never bothered you before in the past now trigger sneezes, hives, acne, runny eyes, itchy eyes. Okay. Me. As our body deals with these numerous changes during menopause, there are many factors that affect the immune system. I already have a defunct immune system, right? Which responds again by overfiring histamines. And the result of that extra firing of histamines is extra sensitivity to allergens. And women experience like new, old, worse allergy signs and reactions. Okay. And there was a recent study that examined the link between menopause and new onset asthma and showed that like the odds of getting asthma were more than twice as high for women in menopausal transition compared to non-menopausal women. What the what? This made me feel so good because my doctor confirmed that I don't have pink eye. He's like, your eyes are just, it's allergy related. They look healthy. Now, mind you, I'm also going to my eye doctor in a couple weeks, but for my annual. But I wanted to make sure I didn't have like conjunctivitis. I don't know how I would have it for a month and a half in one eye, but apparently I am overly sensitive now to Buster's dander, to all the crazy seasons that we're having. And apparently this is a bad allergy season ever. And he's like, you don't take anything? I'm like, no, like I do like bee pollen in my like yogurt or, well, my Coco June. Everyone's like, yeah, I do dairy. You said you had yogurt. Yogurt actually comes in non-dairy as well. Go to the store, peeps. Check it out. Yeah, I use bee pollen, but it's got to be local bee pollen so it picks up all your stuff, right? So I have a farm that's local that I get it from. It's amazing till this year. And so now I'm just going to have a jacked up eye until, until I get out of menopause or this season resides a little bit. Number 17, brace yourselves. Put your big girl pants on. Oh my God, I'm going to make myself choke. Put your big girl pants on because we're going to talk about incontinence. 50% of postmenopausal women suffer from loss of bladder control. Say on the way to the bathroom, or involuntary urinary leakage that suddenly happens with a sneeze or a laugh. Or I can tell you in my situation that I get a trigger sensation that I have to go, and then I say, okay, and I go to put my crochet down, but didn't really feel I needed to immediately toss it to the ground and run like a bat out of, a hand bush and go to the bathroom before I like wet myself. But apparently I do. And don't talk to me about all your Kegel exercises. And I do that. Okay. I do that. Oh, but it's just crazy. So all these urinary issues are associated with hormonal changes that lead us to the loss of elasticity in the vaginal tissues, thinning of the lining of the urethra, the weakening of the pelvic floor muscles. But incontinence is a problem, right? And women, we should not just accept this as a normal part of life. I don't want to buy freaking diapers, okay? I don't want pads, okay? I spent my whole life getting to this point, so I do not have to wear pads. I didn't do tampons, okay? And now we know why there's bad things going on with tampons, but we're still like, into tampons. Nope. Listen, that's just crazy. It's just crazy. And then they're like, well, you could cut back on caffeine and alcohol. And I'm like, okay, I don't drink, but don't even look at me for my caffeine. Okay. With my bougie coffee, cause you will get cut. Look, we're not doing that. Number 18, body odor. Now, I don't think I smell, but sometimes I have supersonic hearing. I wish I had supersonic hearing. I can't hear anything anymore. Smell. So I have a super sniffer, and ever since post chemo, and we're talking like 24 years, I can smell stuff. I could walk into my house and be like, there's bad chicken in the fridge. Like I'm just calling out something. The spinach is rotted. Like you got to throw the package of spinach out. I can smell it. I can find it. Okay. I can also smell things from like blocks away. It's ridiculous. Don't even get me started on BO. BO, I pick it up. I can also smell. So I don't mean to like shame or do anything, but I'm just going to mention, just so for the example, but Mr. Mr. Sith. Lord help me. I need a drink of water. I'm trying to buzz through all this stuff, making sure I cover it all in less than an hour because it's super important and I can't even talk because I'm talking too fast and I'm still trying to find my voice from being sick. So it's like, ho, ho, ho. Anyway, my husband's name is Mr. Sith. Holy Lord help me. He suffers from horrible dental issues. So he's got like 2 crowns he just had done. Then a crown came off and the root cracked. So they take the root out and now he's got a gap. So he's got to get a bridge, this poor guy. But actually I'm kind of a godsend because I can smell if there's anything going awry in his mouth. He'll stand next to me. He'll say something and I'll be like, oh, that tooth is doing something. Go brush it or put some clove on it with some coconut oil and do does anybody oil pull? So oil pulling is when you mix like a warm coconut oil, not hot, obviously, but you liquefy coconut oil and you put in something that's going to help. Like I do clove because it's a analgesic, so it helps relieve pain. And he was having pain, so you just gargle it. You swish it, and you try to hold it as long as you can because you get more beneficial properties. Coconut oil is like an antifungal, antibacterial, it's antiseptic. So it has a lot of properties in it that can help naturally until you can get to a dentist. And his dentist actually was like, your mouth smells like clove. And she's like, that's a really smart thing to do. And I'm like, yeah, duh. So there you go. Because I know. But yeah, my nose can pick up a ton of stuff and I cannot stand it. But so obviously you get the body odor. We're getting the big picture on estrogen, right? That is the big, the culprit. But this hormone influences literally pretty much every system in your body, ladies, okay? Leading to some unexpected symptoms, apparently including also body odor. Now, sometimes I think I stink and I'll be like just shoving my armpit in my husband's face and being like, do I stink? And he's like, no. But I got to check. Hormonal shifts during menopause transition, just like puberty, okay, cause an increase in sweating and overheating, right? I mean, we're getting hot sweats and sweating and night sweats and all that, right? Which can make some women smell a little off. Body odor is no concern for medical, okay, issues. It's fairly straightforward, okay? There's no shame in your game, ladies, okay? So put that shame away and just find simple fixes, okay? Dress in layers. So like if you sweat, you could take one off, put another one on. Try different deodorants. I'm particular about what I wear. I won't wear aluminum. I won't wear mineral oil. So I'm kind of down to a few, but I also will, just in case, like I have found because I'm sweatier right now that I use Native, in case anybody wanted to know, because people ask me sometimes, but I use Native deodorant. I sometimes will not only put it under my arms, but as a, big chested gal, I sometimes put it under my boobs as well. And then I smell like fresh all day, like with whatever I have scented. They are not an antiperspirant though. So if you're trying to go natural deodorants, the ones without aluminum is really bad, but it's in pretty much a lot or all of the over-the-counter deodorants that are commercially sold. If you get a natural deodorant that is aluminum free, that usually means that you can be, it'll help with perspiration. No, it'll help with the smell, but it's not going to help with the perspiration. There you go. The perspiration is the aluminum stuff. So that's a no-no. 19, fatigue. Hello. Did anybody have to tell us that? Anybody who is in any kind of menopausal state, no matter what stage you're in, yeah, fatigue's hello. But it's tricky, right? It's a tricky symptom because it can have a lot of potential causes at midlife, right? Family, work, all of the above, okay? it shows up in different ways. Okay. So this is where you got to look out, right? Self-care, ladies, feeling drained, lacking motivation, struggling with concentration, struggling with problem solving. Okay. You can't remember. You walked into the kitchen. I was doing this. I'm in the middle of a recipe. Why the hell am I standing in front of the fridge? Okay. Hormone fluctuation plays a role, okay, in this and other symptoms of menopause, obviously, especially trouble sleeping and night sweats. They only make the problem worse, okay? 73% of women are affected by fatigue. Hold your britches, for a span of 8 to 14 years. Here's me trying to count backwards, thinking, am I almost done? Have I reached number 14? Am I walking into 15? Because I need something good. I need something good from this. How horrible is that? Right now, I'm taking a Z-Pak and a prednisone load for the upper respiratory infection. And I have a love-hate relationship with prednisone. I was on high dosages of prednisone while I was getting chemotherapy and radiation, which were lifetime dosages, for those of you who don't know my background. And I was on 125 milligrams of prednisone a day for almost 2 years. I stopped cold turkey because I hated what it was doing to my body. And when they finally told me I can quit, I was like, just get off of that taper. I tapered for like a week and then I just stopped taking it. And when I went and saw my pulmonologist, he was like, are you still tapering or did you just stop? As I'm sitting there sweating and twitching. And I'm like, no, I just stopped. Sorry, like 2 weeks ago. He was like, oh my gosh, why didn't you just tell me? Well, I'm telling you now. There you go. So my body, when it gets that drug, I know that steroid instantly within taking it, I would say within the 2 hours after the window, after taking the prednisone, 3 days ago, I started it 3 days ago. Well, it would have been longer now, but I could feel the pressure coming off my chest, the wheeziness going away. It just does that, but it does a number on my lupus. So I'm super sore, super achy, and I can't sleep. Like, I'm not even yawning. I'm not even joking, friends. I slept, Sunday night. I slept last Sunday. I slept 32 minutes. I was up till 4:30 in the morning. And I went upstairs to lay down because I'm like, I got to just pretend. Like, I got to feign sleeping. I'm going to lay here in bed while Mr. Sith is snoring. And I'm going to close my eyes and just pretend to rest. I got this. And then at 5:02, his alarm went off at 5 and he wouldn't turn it off because he was sleeping through his alarm. So I had to wake him up. So I just got up. I was like, screw it. I'm already up. Why not? So you got all this stuff going on. What do you think's number 20? Depression. But this isn't like garden variety moodiness, okay? Depression's a serious condition that lasts for longer periods of time. And it affects about 20% of women going through menopause. It's super, super excited. So, it's important. It's exciting that we're finally getting to talk about this stuff up front. But there was a study published. I got to read this because I don't want to mess up this woman's name. So there was a study published in the Journal of North American Menopause Society. The researcher's name is Ellen Freeman. She's a PhD who explained that there were mental health history factors into your risk, okay, with stuff. Now, this is what Dr. Ellen Freeman says, okay? Quote, women with a history of depression are nearly 5 times more likely to have a diagnosis of major depression in the menopausal transition, whereas women with no history of depression are 2 to 4 times more likely to report depressed mood compared with pre-menopausal women. 2 to 4 times more. That's crazy. Plus, we have all these symptoms going on, so it's just compounding, like they said, the depression. If you're already in the depressed zone, what else is going to happen? You're going to sink deeper in it, right? So definitely seek help. Okay. You don't need to. Estrogen, this is me. Okay. This is estrogen is a culprit again, ladies. It helps support the feel good brain chemicals. Okay. Such as serotonin, the norepinephrine, that's responsible for mood stabilization, alertness, energy. Okay. When estrogen is fluctuating, so it fluctuates, it declines, those chemicals are thrown off along with it. And that's what contributes to depression. There is positive news. Okay. So it doesn't usually follow you past menopause. Okay. So most importantly, it's going to improve sometimes within days or weeks. Okay. With the right support. But if you already suffer from depression premenopausal and you fall into a deeper one, continue to talk to your provider or your therapist about that so they can give you extra support. Okay. Therapy, professional help. If you were taking prescription meds, get them amended as necessary, that kind of stuff, right? Different forms of exercise, walking, dancing, swimming. It just move and get out. Okay. And number 21, 2 more, I think. Important. Okay. But a little known fact, anxiety. 51. Now we were talking about heart palpitations, right? Earlier. Here we go. Manifesting. As many as 51% of women experience symptoms of anxiety during menopause. Some for the first time in their lives. Okay. The symptoms are both psychological, like nervousness, tension, worry, restlessness. Okay. But they're also physical. Okay. And that includes like shaking, heavy breathing, pounding heart, that kind of stuff. Now I get the pounding heart on occasion when I'm super stressed out or I'm super overstimulated. So like the other day, they were like, oh, sit down on the couch. The boys, go sit down, mommy, sit down, honey, and just crochet. We'll do everything. But my son was on TV doing something. My husband was on his phone listening to a YouTube video, not with headphones, while the TV was going. And then he was also participating in what my son was doing online. And then the small dog, Sheikah, was sitting next to me on the couch where I was crocheting, where she usually parks. Okay. Except that Buster was sitting in front of me, panting, drooling all over my lap in my crochet, while Sheikah is like growling and snaring at him. And I'm just like, this is not relaxing, people. I am completely overstimulated. Everybody needs to just shut the hell up right now. Like, what? Can you all just do something that's quiet? It's really strange. And I get that pounding heart. It's really bad. All right. Here's an explanation. I couldn't figure out anything else. Obviously, see a professional for this. But since we've been talking about estrogen through this whole situation, estrogen is necessary for the production of serotonin. Okay. And that's the brain chemical responsible for leveling mood. When estrogen and progesterone levels are roller coastering, okay, during perimenopause, okay, and they start to decline overall, the brain has fewer chemical tools to cope with stressors, and that can result in anxiety. I'm like, man, now, I like to say what helps in this because these are serious situations, but just like the depression, medications, antidepressants, if you don't go that route, cognitive behavior therapies, that kind of focuses on like shifting your patterns of thinking, lifestyle habits, or HRT, whatever works for you. There's lots of options, right? As women, we need to support everybody's option for how you want to treat yourself. This is like why we are a village. This is why we are women, right? We take care of the world and our families on our shoulders. And no other being does that. We create a human inside of us. And then this happens to us after. Like, it's so crazy, right? All right. It's just important. That was my last one for today. We did, oh my gosh, how many did I do? I was at 22. I thought I had 23. 22. 22 different things that affect us, bothersome by all means, during menopause in our life. How incredibly delightful, huh, ladies? How incredibly delightful. So there are actually even more surprising symptoms of menopause. There were lots of weird ones, okay? Which actually shouldn't be too surprising given the wide range of what we've already talked about with hormone transitions in our body. But that list is going to continue to grow as we evolve, okay, and our bodies evolve. And every women's experience is unique. So you do need to talk to someone to help support you if you don't have a grip on these. Like, I am going to see a professional hormone therapist because I need someone who does this on a regular basis who can help me with this. And this is their specialty. And that's just what you got to do to support yourself, ladies. I'm here for you. Hey, this is the only way. These things could be all horrible things, but you know what? All you can say is that we are amazing figures as women. We are powerful. God created us to literally create little humans inside of us, okay? And all these things happen. All you can do is look at it in a positive light and just say, how delightful. You guys have a happy Wednesday until next Saturday. This Saturday, I guess. Lead with kindness. Bye.